Well, hello everybody. Yes, I'm Lesley Fallowfield and I'm a psycho-oncologist, which is a bit of an odd word, but basically it means that I direct a research group that look at all the other important aspects of cancer, the psychological well-being of patients when they're undergoing treatment, impact on their families, the impact on health carers themselves as well. All the behavioural aspects associated with cancer treatment. And we're also lucky enough to receive grant funding from the BCRF. So I'm really pleased to be doing this podcast for you.
Great, wonderful. Thank you so much. So, it's a very stressful time for all of us, but patients, especially those that are in treatment, may be dealing with things that unexpected, maybe delays in treatment or fears of their vulnerability due to treatment and their weakened immune system are, caused by various treatments. Can you talk to us a little bit about how the pandemic and the circumstances that we're all, taking to avoid getting sick or trying to flatten the curve, as we are hearing over and over again. How is this affecting patients, especially those who are in treatment now?
Okay, well, I think it's fair to sort of start off by saying that the anxiety and uncertainty surrounding, COVID-19, the coronavirus pandemic, is worrying enough, even if you haven't got cancer. The impact that all of this might be having on our friends and families, who a lot of us also are now sort of rather divorced from, because quite a few people are, like myself, are in isolation at home, and that's difficult to deal with. I think a lot of patients with cancer anyway feel that the mere diagnosis itself makes them somewhat isolated from some of the normal activities that they might be doing. But I think there's quite a few things that we need to consider that are specific to the patients with cancer. For the newly diagnosed patients, of course, they actually are likely to be deeply stressed by the fact that many of their treatments will now be on hold. They won't even start any treatment. Certainly lots of surgeries have been cancelled in the UK. And this is really, really worrying for them. But I think it's so very important, Margaret, that particularly patients who are at the early stages of disease, just diagnosed, need to focus on the fact that breast cancer, generally speaking, is more of an emotional emergency rather than a direct medical emergency. I don't think they should feel unduly panicked about the fact that they might have, for example, surgery or radiotherapy delayed for a little time. Now, as far as the patients who are already on treatment are concerned, this again has got its own sort of stresses associated with it, because certainly here in the UK and in lots of other parts of Europe, and I suspect that might be happening in the US also, some treatments have had to be stopped. This is primarily because, as we all know, it depends on the treatment that you're actually having, but some treatments that do compromise the immune system make you much more susceptible to infections and viruses. And so it really isn't safe to continue in the current climate having those. But again, I think that particularly if these treatments are being given as adjuvant therapy, extra helping therapy after people have had successful surgery, the likelihood is that it's not going to affect their long-term outcomes very dramatically. For the people who are on treatments to try and keep the cancer at bay because they've got more advanced disease, they're probably in a much more sort of troubled situation as far as they're concerned, because Visits to hospitals, of course, are being curtailed for the same sorts of reasons that we've just been sort of exploring. It compromises your immune system, many of the sorts of chemotherapy treatments that patients are having, and therefore it's not safe to go for regular bloods, regular scans in the way that people would normally expect to. Now, that's not just the fact that people are not having their treatments or the expected investigations and monitoring that they would do normally. I think the contact with many of our healthcare providers, the specialist nurses, other members of the team, is very reassuring. And if you're unable to actually have that sort of contact with professionals who know you, understand your treatment, I can understand why many people must be feeling especially alarmed at the moment. And that's where we've got to actually try and help them.
So what advice do you have for patients? I want to, you touched on various different stages of the cancer continuum, from those who were just recently diagnosed. And I think you make a very good point that it is more of an emotional emergency than a medical emergency, and that there is time. And then those who are on treatment after surgery, and the interruption of some treatments for their own safety. And then, of course, those with more advanced breast cancer who have more of an urgent need to continue therapies. What advice do you have, if we can touch on those different groups of patients, what advice do you have for them to maybe manage the anxiety that they're feeling, and certainly that is created by the uncertainty that we all feel about the end of this and what's, how it's going to affect our lives and, continuing treatment?
Okay, well, I think actually irrespective of the stage of disease you're at, everybody's going to be feeling quite anxious and uncertain. And one of the problems with being in a constant state of stress, as we've seen with some of actually our BCRF funded research, stress causes the body to produce an excess of cortisol, stress cortisol. And one of the worries that you have if the body has too much stress cortisol in it, particularly if you actually have cancer, is that this can, and there's some evidence to show, can cause the cancer to grow a little more quickly. So anything we can do to reduce anxiety and stress is going to be good, because the good news is that we know that there are lots of techniques for reducing stress and therefore measurably reducing the stress cortisol levels. We've shown that quite clearly. Now, how can we do this? Well, we're all very different. We've all got very different sorts of personalities. So the sorts of things that might reduce my stress might be quite different from somebody else. And people will probably know what sorts of things they find relaxing. It could be yoga, it could be meditation or mindfulness. And there are masses of these sorts of programs that are available online and easy to download and get. For other people, it could actually be doing exercise. Now, of course, that's a little difficult if you're in a town or a city where you're locked down and you're not allowed to go out and do normal forms of exercise. But again, there's some excellent programs that people have been putting up online, and some of the TV broadcasting sort of organizations have put for people to do exercise at home. For others, actually, they find maybe just listening quietly to music, opening a window. Actually, one of the delights of lockdown is that there isn't so much traffic or overhead airplane noise. And I've started to hear birds singing again, which is therapeutic and relaxing in itself. So I think people have to know their own bodies. You probably know what helps you relax, helps you feel less stressed, and actually program into your day periods to actually do that. So that's the first thing you can do. Reduce your stress cortisol levels. That will enhance your sense of well-being, general well-being anyway, and it might just actually help your cancer as well. I guess the next thing, though, are all the obvious things that we all ought to do, whether we've got cancer or not, and that we often fail to do. That's pay attention to sensible diet. I guess, again, if you're on lockdown and stuck inside your house, it's even more tempting to go and find the cookie jar or eat sort of all the wrong things. But I think sort of concentrating on eating well, avoiding alcohol, all the usual things are important, and trying to get as much sleep as possible. I guess when you're sort of isolated, also it's difficult if you're used to seeing lots of friends, if you're the sort of clubby type of person who does lots of these sorts of collaborative activities with people, that's going to be a bit more difficult. But again, aren't we lucky that we live in an age where social media does allow us to connect a little more? And I think it's sort of quite good to build in regular meetings with other colleagues that you might work with or family members on a regular basis. Now, these are sorts of very general things, but I think the other thing from a psychological point of view that's really quite important is that all of us like to have things to plan and look forward to. And obviously a lot of that forward planning about things that we might be really, really getting excited about doing are now being curtailed enormously. So I think sort of drawing up a little plan of actually achievable fun things to do is important. And not to dwell too much on the things that now we're not going to be able to do. You know, the holidays we had planned, the theatre visits, the visits actually to see friends and family. You can become very gloomy looking at your diary and thinking sort of about all the things you're not going to do. You must replace those thoughts, if you possibly can, with things that will be achievable, even if it's only actually looking forward to watching another episode of a silly soap opera on TV or something. You try and actually plan a future of things that actually are likely to be realizable. And I think another thing that's really, really quite important to do, I'm a bit of a news junkie, and I certainly, you know, read papers all the time and listen to the TV and radio news. You can do too much of that at the moment and start to feel really, really gloomy. So I'm actually trying personally, for my own sense of well-being, to really, you know, scale down a bit the amount of exposure to really doomy, gloomy things. I think it's important we're aware about what's going on, but try and look at some fun things instead. And again, there's a lot of research evidence that shows that people who are able to make what we call downward social or emotional comparisons fare better than those that make upward ones. Now, what that means is that, let's say, for example, you feel that everybody else in the world has got more money, more cars, you know, prettier gardens, better houses. You're going to feel pretty sort of fed up and unhappy about that. If you focus instead on what are the great things I've got? Oh, you know, haven't I actually compared to some people who are living in tiny one-room apartments? Haven't I got a wonderful house? If you make a downward social comparison or a downward emotional comparison, you're going to feel much better in yourself. Stop trying to compare yourself to other people who are still able to go out, who are able to have fun doing this or that, who haven't had a lockdown yet and can go running around the park or whatever. That sounds sort of rather trivial, but it often helps some people. So I don't know if there are any things there you can unpick that might be valuable to people listening.
That's wonderful. I want to touch briefly on how caregivers or family members can also, what role they would play, what sort of considerations they may need to take during this time, and how can they help the person living with or going through treatment for breast cancer.
I think it's very important. I mean, if you are fortunate enough to have a caregiver or a partner living with you that you get on with well, then, you know, sort of they have an invaluable role to play. I think in helping to keep spirits up, perhaps actually allowing their partner or their friend or whoever it is, whatever the relationship is, who has got the cancer, to express their fears and worries. I mean, I don't think it's sort of, you know, that one should suppress all the anxiety that you actually are experiencing, because that's a real feeling. I think being able to listen to somebody actually say why they're scared, but perhaps to help reinforce some of the sorts of things that I mentioned earlier about the fact that people should have faith in the healthcare providers who will know if in fact it really, really is not safe or sensible for you to visit the cancer centre or to have treatment. So I think any caregiver, informal caregiver, living in the same house as anybody with cancer should be reinforcing all the sorts of things we've mentioned, that the likelihood is that, provided this doesn't go on indefinitely, and I don't think it will, I think we've got quite a few weeks ahead of us, but as long as it doesn't go on for a really protracted period, people's own well-being and health is unlikely to be hugely compromised, with a few provisos, but that's true by and large. And that therefore they should try and relax, try and actually do exercise programs with them, try and actually do their own silly version of meditating or yoga or whatever it is, try and eat healthily with them, and try and create, as I said, things to jointly or as a family look forward to that are likely to be realized.
And that's really wonderful advice. And Dame Lesley, I want to thank you for taking the time out of your day to join us and to give this advice and encouragement to patients who may be dealing with a diagnosis or under treatment right now, and to trust their caregivers, to trust their medical providers, and to use them as resources. I want to thank you again for joining us, and wish you and yours good health, and we'll get through this together.